So we're going to start now with we will be introducing this gentleman near the end of the panel. He will be having something very interesting to say. But right now, with my three doctors, I will be having a discussion. I'm going to ask them a few questions first. And, you know, I'm going to ask the first one that's on everybody's mind. In Riverside County, we have 50% of all of our frontline healthcare workers, doctors and nurses, that are refusing to take the new vaccines that have come out by Pfizer and Moderna. Firefighters are about 40%. You know, there's a big hesitation. Dr. Bhattacharya, I'll start with you. You said some things that sounded good about vaccination. What's your take on that? Do you feel that they're safe, and what is the risk?
My mom, who's 80 years old, to take the vaccine. It's a very safe vaccine. Is it perfectly safe? No, it's not perfectly safe. There are side effects, but the rate at which the side effects happen is very low. At the same time, you do want to take your risk into account. So for children, the vaccine hasn't been tested in children. And as I said, the risk of COVID in children is very, very small. So for children, I wouldn't recommend it. For health workers, I think as health workers, we have a responsibility to the patients we're caring for. It's not just about ourselves. If you're a health worker and you care for someone that's 70 and above, you should take the vaccine, I think, just as a professional responsibility.
Thank you. Dr. Freed, what do you think on this question?
I echo what you've just said, Jay. It's a safe vaccine. I took it. I recommend it to all healthcare workers on the front line. I think that everything we can do to protect ourselves and our families and friends and patients that we need to do. They're novel vaccines, very interesting, and they do elicit a good immune response. It's not as good as the natural immunity from the natural acquired infection, and I think that individuals who have been infected don't need that vaccine and shouldn't take it, in my opinion. But I'm a big proponent of vaccines. I just have a negative aspect because of how our early treatment has been suppressed, and if we'd gotten early treatment out, we may never have needed a vaccine.
Dr. Lapado, are you in agreement with the other two?
Analysis there. Yeah, I mean, I think that, you know, I personally am not, I'm not going to take the COVID-19 vaccine. Yeah.
He's
but,
22.
you know, I think I support people to certainly, make the decisions that are good for their health. And, obviously people have, it's kind of like, it's sort of, what I'm blanking on the phrase from a movie, but it's like, I guess maybe in some ways like Groundhog Day, because we're kind of having this issue again where people whose perspectives differ are being sidelined, or attempts are being made to sideline them. The data we have so far is that, overall, the vaccines, certainly the ones that are available in the U.S. and FDA approved, do appear safe. The concerns that some people have raised are concerns about long-term safety, and there is no answer to that, and there cannot be an answer to that, because there are no long-term outcomes. And that's been, mostly ignored when they have those concerns. They are absolutely legitimate concerns. They may turn out to not be real concerns. We will know with time. But in terms of resolving how you get to herd immunity, it's not by trying to silence other people. You should have a discussion. I think that would be it's a wiser path.
So we've got basically 2 out of 3 that are full on take it, especially in a certain particular group. And I'll tell you what, it's more of an individual choice. In other words, that's what's so great about this country, is that we, each and every one of us, shouldn't be forced to. But if you want to hear some of these rapscallion revolutionary doctors right here, 2 of them actually said, yeah, the vaccine's good. So, there's something, that's what this is actually about. this conference and everything else, find out where we overlap, where we can come together and get some of these things moving forward to do so many important things. Thank you for answering that very, very important. Now, I want to talk about, all we've been hearing about is these really important, people have learned things like flatten the curve. I thought that was something that we did at Weight Watchers, but now that's something a lot more important. It's case counting, testing, and contract tracing. Whoever would have heard of those a little bit more than a year ago. Dr. Bhattacharya, could you address those and how important they are or how unimportant they might be?
Sure. So if you open the news, the first thing you see is how many cases of COVID there are. How many cases are in your county? How many cases are, it's just, and the thing is that the right number? We got to get that. Get it closed. My apologies. Yep. So when you open the news, the first thing you see is the number is how many cases of COVID there are, how many cases in your county, what the are, and often we've been using these to decide whether to open schools, open churches, open our world. And certainly in California, we pointed to these things as evidence that the disease is spreading. The question is, how much should you care about that? To me, it seems like we're tracking the wrong thing. The right thing is, how well are we protecting the vulnerable? How well are we doing in protecting our nursing homes? If cases spread in a school, and we close the school as a consequence of the case spread, are we really doing the right thing? There's a lot of evidence now, actually, for schools in particular, that they don't play a very, very strong role, in fact, almost no role at all in the spread of the disease in the community. Actually, countries around the world have kept their schools open as a consequence of this scientific evidence, that schools don't play an enormously important role. But if we count cases among asymptomatic patients and use that as a basis to decide that we're going to close things, we've actually done more harm than good. Actually, you could go further than that. You can look at suppose you want to go visit your I have an 80-year-old mom. I may want to, I haven't seen her as much as I probably should, but because she lives in Southern California. But when I go visit her, I want to test to see if I'm positive, because I don't want to expose her to the virus. Well, wouldn't it be nice if you could just have a test where you could take it privately at home and then not have to report it? On that basis, you can decide, okay, I'm not going to go. Why is the reporting so matter? Because on the basis of that reporting, suppose it turns out to be positive, and the tests aren't perfect. There are often false positives. On the basis of the positive test, now you have had a 14-day quarantine. The public health officials are going to contact you, and they're going to ask you everywhere you've been, who your friends are. It really makes you have I'll tell you honestly, I've had second thoughts about testing, even when in situations where it would make good sense to do so. And I imagine I'm not the only one. Tying the testing to a contact tracing regimen, which essentially violates our privacy, undercuts our incentive to test. And worse, given how widespread the disease is, you can see from the results around us, it hasn't actually helped and slow the spread of the disease. The testing regimen that we have is guaranteed to provide money for labs and power for public health, but disempower people to make good decisions in their lives about how to manage the risk in their own lives.
Thank you. Do either of the other two have anything to say on those, about testing, contact tracing, stuff like that?
No, I have nothing more to add.
Okay. Okay, so here's another good one. I saw Dr. Lapado, you were talking about convalescent plasma, and I think we've all heard about convalescent plasma. I believe that's when you draw blood from the people that we know that have it, and they've already built up those antibodies, so when you inject that into really sick people, it gives them kind of a turbocharge of something to fight that disease with the antibodies automatically. Can one of you tell us what the difference between convalescent plasma and monoclonal antibodies, and do they do kind of the same thing, and what are the major differences?
I think the difference is about $5,000 a dose, but
Whoa.
Yeah,
Which one's more expensive?
you guess.
Plasma.
No, no. The monoclonal antibodies made by I don't know what the actual cost is, no, those are much more. It's less expensive to, and I think even more developing countries use convalescent plasma. Maybe Dr. Farid probably knows more.
Well, yeah, the developing countries do use convalescent plasma. Um, there isn't a great difference other than that monoclonal antibodies are specific molecules that are genetically engineered, cloned from the immunization of mice and subsequently humanized, so they can be given. And they're screened and tested, and only the best selected that neutralize the COVID-19 virus. And so they become a very rich, precise, specific agent that is among those that are found in convalescent plasma that has many different antibodies, probably. But the monoclonal antibodies are excellent therapeutics, and if they could be given as early as Dr. Lapado indicated with convalescent plasma, if it's given in the early window, the earliest feasible, 3 days of the onset of symptoms, there is definite benefit. Monoclonals are probably in that category. The earlier they can be given, the better the result will be with them. And so they are rolled out in emergency rooms. They should be more widely used in urgent care clinics and other clinic settings, so they can be offered in that setting of the early window. But they will be expensive, undoubtedly. I don't know what their price is. I've asked about it. No one has given me the answer as yet. But undoubtedly, they'll be quite costly on the medical economy.
Dr. Bhattacharya, do you know somebody with a big coat that has some of those at a better price? What's your take on the difference in price on the two?
Usually it's what Joe said, that's usually much more expensive to have these monoclonals, but in this case, the federal government actually is subsidizing them. So for patients, they're supposed to be free. There's a variant of it is something that President Trump received when he got COVID. So in principle, and in fact, one of the things is there's lots of doses of it around that people aren't using it early. I mean, whatever it is that you use, I completely agree with this idea. If we should be using the early treatment that have evidence behind them, and monoclonal antibodies, convalescent plasma seem like they have some good evidence.
What do you think about the recent rollout? So with vaccines, there's the 50% that want it, really want it. And so what we've done is we've got all these tier systems, and we've seen that even here in our state, we've got a lot of stories. It seems like there's no shortage of shaming still. So we've heard stories where they take a certain amount of doses to those tier 1A healthcare workers, and only about half of them take it. So now you've got a bunch of doses, sometimes in the hundreds. And because it has to be, you got 5 hours or something to give it to it. And I've heard stories that they just call up and say, hey, get down here if you want it. Boom, boom, boom. And then other people are shamed because they had an in to the hospital and somehow they weren't essential. Are we doing damage in that way? And I'd like to see what you guys think of that. I mean, it's just we're messing it up on every way we can, or what?
I'm doing damage for what, did you say?
Well, again, we're trying to get everybody vaccinated in a certain amount of time to get certainly safer and the fear factor down so we can open up again. This is the whole thing. We're trying to open up. And the more people that feel safe by either having had the disease and building up immunity or having the vaccine, now we can go about our lives. We're not going to huddle in our homes. But we're doing shaming even with people that somehow get a vaccine ahead of these arbitrary tiers.
I mean, in New York, there's actually a very strange regulation I just saw put in place where if a hospital gives the vaccine to someone that's not on the priority list, they get fined a crazy amount of money. But if they waste the vaccine, they also get fined. I don't think California is quite that crazy as yet. But I mean, I think my preference is that older people get the vaccine first because just for the reasons I told you, they're high risk. But if we're going to waste a dose, that's just nuts. Like, why not use it if it's available? The vaccine does come in these like vials, big vials, and they're frozen, really low temperatures. So you open the thing up, you have to use it. And if there's an extra dose left over, I absolutely am in favor of using it for people that happen to be around.
I would like to at this point actually get, can we get a boom microphone out there too? Because I'm sure there's going to be some questions from the audience if we get a minute or two to do that. But as we're getting that set up, let's talk about the one thing that has bothered each of the three of you, and we'll go down the line and make it fairly short. But the one single thing that's bothered you the most about this pandemic and its response, one single thing, if you could change it with a magic wand right now, what would it be, Dr. Lapado? We'll start with you first.
It would be fear-fueled decision-making. Fear-fueled decision-making.
Dr. Bhattacharya?
I have to pick one thing? I can't.
Yeah. This is just a one thing. I'm sure there's a whole lot of
I
things.
agree with Joe, but let me just say, like, to me, the single biggest thing, and I'm still every day shocked by this, is the absolute blindness and callousness of our public health authorities in charge to the harms of the lockdown. Everyone in this room, everyone in this audience that's listening to this have felt these harms if you're at all, sort of not insulated from it. It's the psychological harm, the division that is created between parents and children, the division it's created between people, the rich and the poor. The lockdowns have devastated our social trust. They've harmed our health, and they have impoverished us. And yet, when I've been now testifying as an expert around the country, and in fact around the world, pro bono, to try to get some of these things, lockdown things, lifted. What I've noticed when the public health authorities respond about their reasoning, they have all these fancy models about how many cases are going to happen, but they have not considered the harms of the lockdown at all in their decision making. They're absolutely blind to the harms of the lockdown, although everyone, again, that's listening, feels it viscerally.
And Dr. Fareed, the single most important thing, if you had a magic wand and could say that this is the worst thing that's been done during the pandemic.
By far, for me, the worst thing has been the suppression of early treatment and the consideration of a number of agents that can suppress the early viral replication and allow the individuals not to progress to be hospitalized and die. And it's started with hydroxychloroquine. It included fluvoxamine and ivermectin or other agents as they come available. They should be tested thoroughly and combined and used, and they should have been offered from the get-go and not have been stigmatized.
Raise your hand if you had a question. Let's get over there and ask them the panel right there, okay? And next in line, right behind you. There you go.
Docs, thanks for being here. My name is Dr. Jeff Barkey. I'm a primary care doctor in Orange County. Like several of you, I'm a member of the America's Frontline Doctors. I've been called radical by my local healthcare center. I've been called a quack. I've been reported to the medical board for advocating the early treatment initially with hydroxychloroquine, now ivermectin, and other medications. Question: what has been your reaction, if you will, personally to you as a result of you all being public? And then second is, I've read article after article after article on the minimal effectiveness of masks in preventing a viral illness. New England Journal had it, articles in the past about prevention of influenza and cold and so forth. Could you give us a quick opinion on your perspective on masks, and then your personal reaction from anything personally that's happened to you and how you've dealt with it, the blowback from you guys advocating what you're espousing today?
Could I make a comment quickly? I'm sorry to interrupt. Thank you. Excellent questions. Congratulations. I'm a frontline doctor too. I have ignored totally any reaction against me I got or not vindicated, but I got picked upon by our county health officer for treating nursing home patients with the HCQ cocktail. If I'd met Steve earlier, I probably would have used fluvoxacine. In addition, HCQ is an agonist of the sigma-1 receptor 2, and the two together might be an extremely good option. But in any case, I've felt that by people in the community or doctors even that have not wanted to do anything, that have accepted this don't do anything approach, and you're going to do harm if anything. And I've just ignored it, and I'm isolated in a rural area on my own, and I've seen the truth. I've seen the patients improve and the expressions, and it may be that Luvox or fluvoxacine is going to even be faster in achieving that. Whatever it is, I'll use it. Thank you.
For me personally, it's been very challenging. I've had my work censored by Google. I've lost friends. A whole bunch of my friends are now not going to talk to me, I don't think. I don't really understand I mean, I thought I lived in a society that valued free interchange of ideas. I thought I lived in a university worked in a university that valued that, and I've come to question that. But I don't see that we have much choice. We have to say what we see and be honest about it. I might be wrong about some of what I believe. I'm sure I am in some ways, but how do we know unless we discuss openly? I really regret that you've been attacked in the way you have. I think it is a failure of our professional responsibility if we don't say what we see. And I think what I've learned from the Great Barrington Declaration is that there are a lot of people that think like we do. They're just cowed into silence because they don't want to face the press attacking you, mischaracterizing you, accusing you of things you don't believe, which has all happened to me. I mean, but there's no other choice. We have to speak up because, I mean, millions of lives are at stake here.
Any other? Somebody wanted a question right there.
Thank you for being here today. My name's Sean Mitchell. I'm with the Elk Grove Unified School District, which is local here, and we're the parent coalition. So we've kind of stood up to. We've been out of school now for coming up on a year. And what would you say? You mentioned some things about future health risks and the consequences of the lockdown, so to speak. What do you see as? What would you tell parents? What are they looking to in the future, and the impact to our children and our future? What would you say to parents as doctors? What do you say to them?
It's unsafe not to send your kids to school. It's unsafe not to send your kids to school. I think 50% of private school kids are back in school, 5% of public school kids. I mean, the only question in my mind is how long we're going to be counting the cost of this generational inequality we've created. And there's not getting it back. We've now missed almost a year of school and counting. In California, I fear that we won't have our kids in school until September at the earliest. I think we've robbed our children of their birthright. Send your kids back to school if it's at all possible. Advocate vociferously. Speak up, because that's the only way it's going to change.
Okay. I want to make Julie, you want to come up, and where's the bus? Okay, the bus is in front. I also want to let you know that those of us that are going down to the protest, you have to have a mask, so take a mask with you. They're going to be very, very hard about that. But we will be getting on there. We'll probably be leaving at, 3 o'clock? All right, so we need to we're going to wrap this up. We got to get going. We could have engaged with these gentlemen, all four of them. Let's give a big round of applause to a phenomenal panel. And again, I am so honored to stand up here with such great, they're really, really giants in what needs to happen today. And remember, we're going to come back here after the protest, and then we've got another panel tomorrow. So, hey, this is day 2, and we're going to feed you tonight, too. So there's a lot more good stuff. All right, guys, let's get out there, get on the bus. We got a protest to do.